Hello. Okay. So let us continue with Nash therapeutics study streak. And yes, hello, Musadik, SD, Razi, Dr. Kavya Sri, some regular people who are joining on Instagram and YouTube. And we are doing this thrice a week, but we are keeping remedies some days 4, 5, some days 2, a minimum of 2 at least, which covers our quota of studying one remedy per day. So, good evening, Dr. Razi. Let us continue with Nash Therapeutics study streak. Today, we'll cover two remedies which Dr. Nash continues once he finishes the last set of remedies. And the remedies that we discussed today will be phosphoric acid and muriatic acid. So, one of the remedies, which is phosphoric acid, is frequently used by many homeopaths. And sometimes, if you don't know how to use it, it becomes difficult because there are a lot of remedies in Matita Medica which need to be explored from the clinical point of view rather than just the academic point of view. And phosphoric acid is one of them. So, what does Dr. Nash write about phosphoric acid in the Leaders in Homeopathic Therapeutics? He says that this is the leading remedy for its effects on the sensorium. The patient lies in a stupor, unconscious of all that is going around him, but when aroused, is fully conscious. And if you just understand these few lines, what Dr. Nash tells us, this is going to be your crux for prescribing phosphoric acid. All the patients that will be in this state of semi consciousness will mostly require this remedy if they become fully conscious when they are woken up from their semi conscious state, unconscious state, and they'll be aware of what's going on. Not like Arnica and Baptisia, which are not aware of what's going on and they are lost in time and space. So, if you understand the awareness of his mind, he is physically weak. He cannot move. He is lying there in the bed, the patient, and he is fully conscious when he is brought back to his senses. That is phosphoric acid for you. The remedy affects the sensorium. The patient does not have the energy to move. That is your observation, or the relatives will tell you. And Dr. Nash tells us that this remedy is not alone in sensorial depression. So, phosphoric acid, he says that it is indicated in depressing emotions, grief, loss of friends, loss of lover, and its effects are deeper than that of ignatia. So once you understand the levels of each remedy, you will be much more confident in practice. Acute and short grief, which stays for a short time, will require ignatia. If the patient keeps on brooding over it, then still it will be ignatia, provided the brooding is there, because in brooding you will find ignatia. And a deeper state of ignatia you will find in natrum. If the patient is controlled by some authority, in not able to express the emotion along with the grief, it will be carcinosin. And if there is lot of weakness which comes up over a few weeks and months, and ignatia and natramur have been given or they have not worked so well, the next remedy that you should think of is phosphoric acid. And Dr. Nash tells us that we need to compare this remedy with lachesis. He also compares phosphoric acid with ignatia by telling that ignatia may have nervous issues like twitching, but phosphoric acid will have a settled despair. So the grief has settled and now he has moved on, but he still connects to it. He does not keep on telling about it like ignatia does all the time or natramine does all the time, but there will be a settled despair. It is there in the back of his mind or it is there in the history. Dr. Nash tells us that he gave ignatia in one of the cases and he failed, and how he found that phosphoric acid is a good remedy in such a case. And how did he find that? There were crushing weight on the vertex in the patient, and then he explains how there is a physical symptom which will lead you to prescribe phosphoric acid, which is pain in the occiput and the neck, and the patient appears physically weak, exhausted, wants to lie down, does not want to be noticed, and does not need the company, does not want to speak to. So you will find the relatives describing this state, that the patient is lying in the corner of the room, not speaking much. If you get a chance to ask the patient about how is your behavior in the last few days, when you observe that he is not smiling much, or you want to ask him about mind symptoms, he will tell you that I just keep on doing my work in the corner of the room and I do not interact much with other people. That is the prescription for phosphoric acid. And the depression is worse if the patient grows too fast or is overtaxed mentally and physically. So in young people, how we will find the recipe for phosphoric acid? When the patient is growing far more faster than their normal age, and this is what we see in calcarea phos, and this growing faster comes from the phosphoric element. So the patient is growing too fast, or he has been you know again and again hit with lot of mental traumas again and again and overtaxed. That is mentioned by Dr. Nash, that the depression is because of overtaxing of mental and physical areas. So you will see that calcarea carb will grow fat horizontally, whereas phosphorus will grow tall. So all the remedies that are having phosphorus as an element in their compounds, and wherever you will need to prescribe phosphorus, you will see that these patients have grown far more faster than what their age is. And calcarea or the carbon compound usually grows horizontally or they become fat. And he recommends phosphoric acid for headache of students who are growing too fast. So phosphoric acid, Dr. Nash tells us that It needs to be differentiated from calcarea falls and natramure. And I already conveyed in a few minutes uh, earlier in the session how Ignatia, natramure, carcinosin, and phosphoric acid will be a different remedy for different stages or different patients depending upon how they have been brought up or how they are bringing up their mind, the evolution of their mind. Phosphoric acid, Dr. Nash tells us, is almost a specific in typhoid, along with arnica, opium, rust ox, hyoscyamus, nux moscata. And Dr. Nash gives us a very good explanation of all the remedies, one key symptom each, and then he moves on to explain that how phosphoric acid is important for gastrointestinal system. Its action on the bowels should not be forgotten. Meteoristic distension of the abdomen. If you read the words exactly how Dr. Nash has mentioned, I will reproduce it for you. Meteoritic distension of the abdomen, rumbling and gurgling noise as from watery painless stools. So whenever a patient tells me that there is watery and painless stools, few remedies strike my mind immediately. One of them is phosphoric acid, another is croton tig, another is strontium carb, again China officinalis, and you need to differentiate these remedies based upon whatever modalities are available or the concomitant symptoms. Over here, there is no pain, which is very important, and it will be in small episodes which will weaken the patient generally. Croton take one stool episode, immediately the patient is weak. Whereas phosphoric acid, he will grow weaker gradually. So Dr. Nash gives us his lines of importance for phosphoric acid from the gastrointestinal system, and then he also compares phosphoric acid with China officinalis, where there is lot of debility from the diarrhea or loss of fluids, but phosphoric acid is more attacking or more predisposed to act on the people who have nervous system disturbances or the sensorial depression first, and it is independent of the discharges. So there will be two episodes of stools and the phosphoric acid will grow weak immediately. But in China, there will be 6 or 7 episodes and the patient is then become weak. Within 1 or 2 episodes, he is not so weak. So that should be your ability to differentiate between these two remedies. And then Dr. Nash tells us how phosphoric acid has a weak feeling in the chest when talking, like sternum met, and the differentiation is important. Phosphoric acid will have copious and offensive and purulent sputum, whereas sternum met will have thick, heavy, and sweetish sputum. So, last but not the least, Dr. Nash explains how phosphoric acid will have two types of urine. One is profuse urine, and another is clear, watery, or milky urine. So, profuse urine will be in the cases where there is nervous depression like gelsemium. Again, over here, like gelsemium also means that the patient gets better with the flow of urine, which is there in gelsemium as well as in phosphoric acid. So, you need to differentiate from the physical modalities. And milky urine, you will see that there is excess of phosphates, which indicate the nervous wastage or the nerve is wasting its, shedding its parts, and that's where we will see phosphates in the urine or milky urine. So I have already in Alan's keynotes study streak explained about how you can use urine routine as a parameter to differentiate few remedies. There is lot of such rubrics where you will see that the urine is examined in detail, macroscopic and microscopic, and our old authors had this idea of watching the discharges of the patient and decide the remedy. That cannot be interpreted, that is there as it is. See the nature of the stool, see the color of the stool, see the urine, how it is in appearance. That will give you a clear definition of how the remedy behaves when it is proved, when there is poisoning, and when you want to give the remedy in clinical practice. Otherwise, you are just doing lot of interpretations and giving a remedy which is, whether it will hit or not, we don't know. So Dr. Nash gives us this explanation for phosphoric acid about the different types of urine and how it is important from the clinical point of view. And that's where he ends. And now we begin the other remedy, which is muriatic acid. So, again, Dr. Nash tells us that muriatic acid is a good remedy for typhoid. So, all the acids he will tell you more or less are good for typhoid. And the cases are of a lower grade than phosphoric acid, which means more deteriorated. And Dr. Nash tells us that this remedy comes closer, muriatic acid comes closer to carbovage in such situations. There is decomposition of fluids, involuntary stools, hemorrhage of dark blood, moaning and sliding in the bed, excess of weakness, tongue is leathery, dry, shrunken, paralyzed, and pulse is weak and intermittent. The entire picture of typhoid is placed in front of you in the remedy muriatic acid. And if you, it's difficult for a homeopath at this stage to get to a stage where he will find this kind of picture, but you can start the patient with some basic remedies like bryonia, rustox, and then move on to the acids and the carbons. So you will see that the plant remedies you will be giving the first, which will be more of a acting on the functional levels, and then once the tissue damages are done, you will be moving to remedies which will give more action and benefit from the tissue point of view, which is the carbons and the acids, carbovage and the muriatic acid or phosphoric acid, whichever you wish to. There will be some remedies which will be required in deeper stages, like baptisha is one of them, but a few of them are needed. So you will see that there is a kind of a differentiation of different remedies at different stages. And in the typhoid cases, homeopaths nowadays get very less chance to prescribe for a long duration because the patient does not wait for that time. But you can begin somewhere, and there will be out of 10, 5 patients or 2 patients that will wait with you. I have taken a couple of cases in the fever workshop, and I'll be putting up the recordings for those who wish to solve typhoid cases and how you will do that. It's there in this entire workshop which we had taken up last few months ago. So muriatic acid, directions for how to give muriatic acid and when to give muriatic acid and what will be the diet in muriatic acid. This is very well given by Dr. Nash in his book Leaders in Homeopathic Therapeutics. So you need to open the book, read it. I will not put out the entire structure what he has mentioned. It is there in few lines, but it is of very good benefit if you go and read the remedy from Leaders in Homeopathic Therapeutics by Dr. Nash. Last but not the least, Dr. Nash gives us that muriatic acid is useful in hemorrhoids, and thus hemorrhoids are swollen blue. You will have a congested appearance. It can be greenish in nature. It's very sensitive to touch, and the patient cannot bear to touch the anal region on the chair or anywhere. He will not be able to sit down. He will need to keep standing. That is the observation. So you will find the opposite of what we see mentioned in the books. The patient will take the opposite behavior because he may not be able to explain you the exact modalities. Once you understand these things, you will have a clinical understanding of the remedy and their behavior they adopt in the clinical practice and in their daily life. So muriatic acid, and it's good to see some new people joining. Dr. Neela, Mahajan Vanshika, Dr. Naveen, Dr. Kalyani Vaje Kanchan, Dr. Narendra Paul, Dr. Samuel Kumar. I don't know how many of you are online, but if you want to master the practice from the clinical point of view, it is good to stick to the basic books, which is why I am undertaking these study streaks so that you all are updated with some information from my side and something from the old authors as well. Let us revive these authors and keep homeopathy in its truest essence, which is what how they practiced. So muriatic acid, I was talking about how it is useful in hemorrhoids, and the patient will adopt a posture which is exactly opposite to what is mentioned in the books. It will not be exact. The patient may not tell you that he cannot bear the touch of any object below, but he'll tell you that I keep on standing, that makes me feel better, or I adopt an different posture, and the rectum also prolapses, so there is kind of an expulsion of those organs immediately outside with lot of pressure, and the bladder is also weak, the urine passes slowly or the patient has to press. So that's what brings us to an end for muriatic acid, and we'll meet up tomorrow again with another set of remedies from leaders in homeopathic therapeutics by Dr. Nash. And in the meanwhile, keep following Homeo Setu in WhatsApp channel. We have a WhatsApp community, WhatsApp channel, Instagram and Facebook and YouTube and Twitter, wherever you are. There is an interesting learning that is going to help all homeopaths. So stay tuned and stay connected.